Hello friends, hope you all are fine today. I'll talk on tuberculosis. I'll tell you the role of sputum smear microscopic examination of tubercle bacilli in the diagnosis of pulmonary tuberculosis. So let's start, friends. First of all, I'll tell you the symptoms of pulmonary tuberculosis. What are the symptoms the pulmonary tuberculosis patient will have, and the patient will come to health facility with this type of symptoms. Mostly, the patient comes with cough for long duration, maybe more than 2 to 3 weeks. In developing countries, usually the symptoms will be cough more than 2 to 3 weeks. You have to consider that. And other symptoms like fever, loss of weight, loss of appetite, chest pain, breathing difficulty can be there. But mostly patients come with cough for more than 2 to 3 weeks. Whenever a patient comes to outpatient department, be it a government facility or a private facility, or patient might have cough with some other symptoms also. In that condition, we physician we suspect pulmonary tuberculosis, and for confirming this diagnosis, we have to do the appropriate investigation, appropriate test for diagnosis of pulmonary tuberculosis. Now, I'll tell you another important thing, that is, if it is a developing countries like India, we consider cough for more than 2 to 3 weeks as a borderline, like we'll suspect pulmonary tuberculosis, because the prevalence of pulmonary tuberculosis in developing countries are high. But in developed countries, the scenario is different. There, the duration of cough may be less than that. And in developed countries, what happens is the prevalence of pulmonary tuberculosis is low, and the patients are usually very conscious. They come to health facility immediately. They have some health problem. So we have to consider this investigation for pulmonary tuberculosis if we suspect pulmonary tuberculosis in developed countries also. But the difference is the duration of cough will be less in case of developed countries. Now, what are the investigation we'll ask for? Here is the discussion. So, the most important initial test for diagnosis of pulmonary tuberculosis is sputum smear microscopy for tubercle bacilli. We will ask the patient to give expectoration or sputum in a pot, in a sterile pot, and that will be given in a laboratory. And lab tech will do this investigation and give the result. Accordingly, we will plan the treatment. If the patient is sputum smear microscopy for tubercular bacilli positive, then we start on antitubercular treatment. If the patient is negative, then we can consider some other investigation like chest X-ray and CT scan. Now, why this sputum smear microscopy for tubercular bacilli is the most important initial test? See, this test is very simple test. Any lab tech with some training can do it properly. This test takes very less time. The result will come very soon. Within 1 or 2 days, the result will come, and it will be free of charge. In government facility, there is no charge for this investigation. So we advise this sputum smear microscopic test, and we start on treatment on the basis of the result of the investigation. Okay, we physician advise for this test, and when the patient comes to health facility for some other problems also, then any administrative staff or any laboratory technician or paramedical staffs like nurses, they can also ask for this test, and they can also advise the patient to do this test. They can refer the patient to laboratory for doing this test. Because see, these pulmonary tuberculosis patients, they are source of infection to the community. They spread the infection. So not only the physician, other paramedical staffs and other administrative staffs, they are also responsible, and our responsibility to the community. We have to do this, and we can advise the patient to go to the lab and do the investigation, because this test is very simple. Any patient can do, and free of charge also. So a patient can be referred to lab, and the patient can do this test and come to doctor with the report. So accordingly, physician can decide the treatment. Now I'll tell you the reason of this sputum smear microscopy, why this test is so important, initial test. See, the test we do for diagnosis. So mainly the pulmonary tuberculosis diagnosis can be done by this test. So first point is diagnosis of case. Secondly, we can judge the infectiousness of the patient, how much this patient is infectious. Then, when the patient is put on treatment, we can monitor the progress of the patient, like whether the patient is improving or patient is not improving. Again, during the treatment, we do sputum smear microscopy and see whether the patient is improving or not. And lastly, the confirmation of cure. After the patient completes the treatment, then we do the sputum smear microscopy again to know whether the patient is completely cured or not. And another important thing is the sputum microscopy can detect the source of infection. Because we have to know the source of infection in the community, so that we can give treatment and we can prevent the spread of pulmonary tuberculosis infection. Now, lastly, some other tests of sputum are available, like sputum culture. Here I have to mention this because it is related to sputum test. So sputum culture for pulmonary tuberculosis is also another test which is also very important, and we can know the sensitivity also, drug sensitivity. But here I'll tell you one most important thing, that is why this sputum smear is given so much importance than culture of sputum, because there are lots of operational advantages. See, sputum smear is a very simple test and free of charge test, but sputum culture is a little complicated test, and it needs expertise, and it is not that free of cost. Like, it is costly test and it's little complicated. The result will not come within 1 or 2 days. In sputum smear, the result will come within 1 or 2 days. So that is the thing. And there are operational advantages, like we can know the infectiousness of the patient. If the patient is sputum smear positive 1 plus, and that means that patient is less infectious than a patient who is sputum smear positive 4 plus. So that one point is there. So the infectiousness of the patient we can. Then the next is which patient need extension of treatment, that we can judge. If a patient is put on antitubercular treatment and we do sputum smear microscopy after the intensive phase and the patient is still positive, then we will continue the intensive phase. So we can understand the extent of patient's progress of on treatment, and we can judge the treatment plan. We can change the treatment plan also. And last thing is we can identify those patients who are at risk, at high risk. Those patients who are sputum positive 4 plus or more than that, then those patients are at high risk of death if not treated. So these are the thing about sputum smear microscopy. I'll emphasize on this because I'm dealing with TB patients. So I request all of you, if any patient, any person around you having cough for more than 2 to 3 weeks, he must do sputum smear microscopy for tuberculosis. Thank you for watching this video. And today I did this recording in my car because I was just feeling like doing this. It was just for a change. Thank you for watching and stay healthy. Bye.